In 2024, I performed nearly 300 vertical restore surgeries. It has been an incredible year of profound and beautiful looking outcomes. Today, we're gonna take 4 cases and we're gonna evaluate them. These particular cases represent something unique and they can capture a category that we can discuss. I think you'll find it very, very interesting. So let's start off the first case with my wife, Netta. So the changes that started really bothering Netta, her jawline, her mid-face, even her lateral brow, and her neck started to sag forward. You can see her overall volume status is in pretty good shape because she's had a fat transfer done when she was 36, but there are specific areas like a little bit around her chin and a little bit around her temples that needed a touch of fat transfer to restore the volume. When you look at her under eyes closely, you can see there's a bit of excess skin there. All of these changes are a very normal and consistent part of facial aging and were the reasons why she wanted to undergo the particular procedure. When you look at her before and afters, you can really tell how repositioning everything back into its original position, which is a vertical orientation, that's what the vertical restore achieves, really creates a natural, beautiful facial rejuvenation. The changes around her eyes leave her looking very natural without changing the shape of them. And that little touch of volume with the fat transfer has really restored her in a way that makes her look a little bit more refreshed, not puffy or swollen. When you look at her profile, you can see the jawline and the neck are extremely firm and beautiful contour with all the soft tissue being lifted. This is what people refer to as snatched. When you look at her on the 3/4 view, everything has gone back into that vertically oriented position, and that's something that makes the outcomes of vertical restore so unique and special. Many of you have watched the long form video where we took you through her entire process, roughly to around 3 months or so after surgery. And a couple points about her overall journey. I did a fat transfer on her when she was 36 because she lost a lot of volume as a result of pregnancy. As soon as she was done with the 4 pregnancies, we did a fat transfer on her. It kept her looking great from 36 all the way to 52. So it gave her a lot of time. During that period of time, all she did was take care of her skin. At first, it was a combination of all the things that are now in the trifecta. In the last 3 years, it's only been trifecta, plus very, very regimented sun protection, a little filler here and there, a little bit in the lips once in a while, a little bit of fine line here and there. Maybe that like once every 2 years or so, we would do something like that. And then when the time came, we did the vertical restore. She represents the combination of young-looking skin combined with a young-looking facial shape. When you have those two things, that's where you look really young. So the two-pronged approach that I talk about, skin and shape, she exemplifies that and really represents that very beautifully. Netta's case is obviously unique because she's my wife. And operating on your wife is not something that is commonly done in any specialty, especially plastic surgery. But one of the things that really prompted us to do it this way is because at the core of an expectation that we all need to have fulfilled is to look completely natural and completely unoperated. That is a criteria that was extremely important for Netta and for me was absolutely the most. I can't imagine anything worse than having my wife come back after surgery and looking like a different person or looking tweaked or pulled. And I don't mean this to pat myself too firmly on the back, but I really believe that I could produce that type of outcome better than anyone else can. And she did too.
I'm really excited. I think I'm really, really lucky.
Would you have honestly ever gone to a different surgeon?
No. I don't even know if I would do it actually. I think it'd be really hard for me to find someone to trust to do my face.
And frankly, if we didn't, I would be more than happy to give her off to some surgeon and say, hey, please do this for me, because operating on your wife is definitely stressful for so many reasons. One, it's a loved one. Obviously, the act of surgery is not exactly a, how do we explain it? I mean, you're literally cutting somebody's face and you have to have a certain level of separation in the moment to be able to see them as a surgical case as opposed to seeing them as your wife. That level of objectivity is very disciplined and is important so that you can perform surgery in a really, really sound way. And that was something that I had to search very deeply within myself to figure out if I can live up to the challenge of really looking at her in the same way I look at all my other patients. And I didn't know exactly how I would respond, but I found myself capable and able to get into that mind frame so that I could be the best surgeon I can be in the same way that I can be every single day and not get overwhelmed by the moment or the situation. Additionally, when you operate on a family member or something like that, you you get to see them through the entire recovery process. Now that's good and bad. It was actually good in my case because it taught me a lot about recovery, which I was able to translate to so many of my patients, and literally made me a better doctor as a result of being that close to the entire process, watching the day by day. It really made me much more empathetic and much more capable of understanding what patients go through. The downside is, if you can imagine, if something didn't go right, even if it was a complication that is resolvable, I'd have to live with that complication, whether it's a hematoma, is an infection, a little bit of weakness in a smile, whatever, all the things that can happen to any case. Obviously, they happen in very, very low percentages. All of that together is less than 1% possibility. But there are things that you're going to have to physically face day in and day out, because in so many of these situations, you just got to kind of sit back and let things resolve themselves. And being close to somebody makes you want to do more than you probably should. The key thing was timing. When are we going to do the surgery? She was 52 at the time of the operation, but had been thinking about this maybe for the last 2 or 3 years.
Ever since like 48, 49, I know I need to do it. It's only the downtime, the 1 month of not doing anything, that's really hard for me to embrace. I hate pictures of myself. I don't like any pictures anymore. I would rather do it before I look like majority of the people who that's when they think they need surgery. I'd rather do it early on and look my best through my 50s.
It was a very, very exciting transformation, mainly also because I was able to share it with all of you guys. I mean, our community on Instagram got tons of views, close to 500,000 people watched her YouTube video. And the amount of positive feedback that came as a result of that has been extraordinary, because at the end of the day, to be able to see somebody go through it day by day really had the effect of reducing the stress of the unknown to so many of our patients. So super, super excited and glad to be able to share her transformation. And that was probably one of the highlights by far of 2024.
I was for sure not feeling like myself. I was noticing changes a lot. They were occurring fast. And I was like, wow, this is what he talks about when all of a sudden you go downhill. I feel like this is exactly me. I relate more to the face I see in the mirror, the face I see in pictures, and I'm done. And I really love it.
And her commitment to her skin has been totally on her. She's literally never misses a day and is dialed in completely. And it shows. I mean, her skin looks amazing. She's great with sun protection. This is what we can all learn from Netta. She leads by example, and is an example that I think really impacted the way I approach my own patients. So Kathy's primary concern was the overall laxity and fullness of her neck and jawline. This is something that grew significantly as she began to age. And when you look at this on profile view, you can see the entire jawline neck contour has been obscured, largely due to the fact that there is an excess amount of fat coupled with laxity both below and beneath the platysma muscle. And this needs to be addressed in order to get a really contoured and thinner looking neck, which was the goal in her surgery. But in addition to that, when you look at her lower eyelids, you can see there's some excess skin and puffiness. And then when you look at the overall volume status, although she's generally full, there are specific areas of her face that have lost volume, specifically her temples, underneath her eyes, above her eyes, as well as the pre-jowl area around her chin. When you look at these before and afters, the most noteworthy thing is that Kathy completely looks like herself. There's nothing about her that has fundamentally changed. She's completely identifiable. You would actually never know she's had any work done, despite the very dramatic amount of changes achieved with the vertical restore and the above procedures. When you look at what has been done to her neck and jawline, you can really appreciate the removal of the deep fat compartments as well as the superficial fat compartments, and a complete redraping or recontouring of the lax facial muscles and neck muscles. This is the beauty of the vertical restore, as it can both achieve dramatic changes while leaving a person looking completely natural and unoperated. These are considered advanced neck cases. I do the vertical restore, but I do it in a way that focuses a lot on removing the excess soft tissue out of the neck. So fat above the platysma muscle, fat below the platysma muscle. It's a real neck contouring type of an approach to be able to get the shape to look the way it does. I don't touch the glands, I don't shave the glands, I don't do any of that kind of stuff, but to be able to create a case like this without having to do some of that type of work that has a high risk reward threshold, very, very pleased with what I see in her case. And what's beautiful about Kathy's case is, in many ways, this is the best neck she's had her entire life. And that is a very, very powerful thing. And for a lot of people, that creates so much joy and really just a change in perception of themselves in life, to have something like this done for them. And also as a surgeon, it's super rewarding to be able to take on a case like this and create a change like this without jeopardizing the deep anatomy. When you do that much functional and structural changes to the architecture of the neck, it is invariably going to take time to heal. So there's oftentimes little irregularities, fullnesses in different spots. Now, we try very, very hard to do the things at the time of surgery and immediately postoperatively to minimize those. So for example, I leave drains in typically between 4 to 6 days after surgery to suck away any fluid that can cause some irregularity into that area down the road and prolong healing. I also put compression sutures in, which compress the new skin envelope against the new underlying tissue contour, and that also stays in 4 to 5 days, sometimes 6 days, to really create and establish the shape. Nevertheless, swelling takes place. Nevertheless, the skin has memory. All of that contributes to a little bit of a prolonged healing process when you create that much of a change. And what is the reason why some people's neck age this way versus others? It literally is simply genetics. We see people in their 20s and 30s that have fullness in their necks, and it just gets exacerbated and worsened as time goes on. Weight has very little impact on that aspect. Some people age by just purely sagging. Some people age by fullness plus sagging, and Kathy represents the latter, and as a result, the Vertical Restore adapts according to those changes, and I can modify the way I do it in a customized way that I can take care of a neck like hers. The end result, chef's kiss, looks amazing. Super happy for Kathy. She really represents the concept of the full neck and what can be achieved when you apply the right technique in the right hands and ultimately get a beautifully natural looking result like hers. In Dana's case, a lot of her concerns are typical for an average 50-year-old. There's an overall change in facial shape with a downward direction of the jawline and the neck, and the sagging that occurs around the jawline, causing jowling, as well as some sagging beneath the neck structure. And this is going to be addressed by an upward elevation with the Vertical Restore. In Dana's case, when she gets lifted, there's going to be some excess skin beneath her eyelids. So as a result, a skin pinch would be beneficial. Also, you can see volume loss in the typical patterns around the eyes, the temples, the lips, and pre-jowl area. This seems to be ubiquitous areas of volume loss, and we're not going to be putting any fat back into her cheeks. That's an area that has lost laxity but hasn't lost volume. So adding volume to that region will actually create a puffy midface that is not attractive or natural looking. When you look at Dana's before and afters, you can really appreciate how subtle and natural yet dramatic the changes are. Despite the fact that not a lot of tissue needed to be repositioned, just that small amount of repositioning and redirection creates a very youthful and natural look. And this is something that everyone wants. They want to retain their identity, but yet look refreshed and rejuvenated like they did when they were in their 30s or early 40s. The beauty of this outcome is she had just turned 50 years old, started to see the laxity starting to happen. She's been on the trifecta. And when you combine, again, young-looking skin with this beautiful new facial shape that represents the younger look, the results are dramatic and beautiful. Now, she is only around 4 months out, so she's still technically healing, but already you can see close-ups of her incisions, how beautiful they look. The hairline, the ear anatomy has not been altered at all. She really does represent the typical ideal healing process and represents the perfect time to address the aging changes so that you don't have to live with them for too long. Truly, she looks like somebody who's at least a decade to a decade and a half younger than her actual age. But the beauty is this is how she feels on the inside. She feels like a 30-something-year-old and now has a face that represents that as well. And she really represents the typical facial rejuvenation patient in my practice these days. More and more people are wanting to address their laxity at a younger age, meaning that they don't want to wait till things get really far along before they do something about it. Honest to God, there is no specific age criteria. You definitely don't want to do it before you need it, and obviously we're not going to let you do that. But if there's enough laxity there, and you can tell by when you go up like this, you put your finger here and here and you kind of pull up, if you see things really making a significant enough change and you're emotionally ready to do such a thing, then that's a perfect time. I don't recommend people arbitrarily waiting. If it's bothering them today, might as well take care of it today if you can. And if it's not bothering you today, then don't address it. It's not like, oh, you turn 50, you should get this done. You should do it when you feel ready and there's enough physical change to justify a surgery. Typically, anyone who's above the age of 50 will start to see these changes to a degree which a procedure like the Vertical Restore will directly be able to help them with. When we look at Joni's before photos, you can really tell that advanced aging has taken place with the significant amount of laxity along her mid-face, lateral brow, jawline, and her neck. There's overall laxity around her upper eyelids and her lower eyelids as well. And even the upper lip becomes longer. This is something that we typically see as aging continues to advance, that the entire soft tissue envelope lengthens and becomes heavier and downward directed, as well as the fact that in every patient, you're gonna see some volume loss ubiquitously across the board, no matter what age we're doing these procedures for. Now, when you look at her beautiful afters, you can see the essence and that vibrancy has been restored with the vertical restore, fat transfer, upper and lower eyelid blepharoplasty, as well as a lip lift, and how beautiful her skin looks on the trifecta. Despite the significant amount of change that has taken place in terms of laxity and repositioning, she looks completely natural. She looks totally like herself and yet looks very youthful. And you can see that confidence and brightness really come through. And I just absolutely love seeing these. She might actually be the oldest patient in 2024, but you would never know it if you interacted with her.
This is 2 weeks post-op. I feel so healthy and happy. This is me this morning with no makeup. So just a little lip gloss and trifecta and off we go.
This woman is so vibrant, so full of life, and I can't tell you how inspiring that is. And it should be inspiring to all of you, because to feel that way at her age means somebody like myself who's 51, I've got a lot to look forward to in the future. I just have to emulate that type of lifestyle, which has really led to several videos that I've recently created on the idea of this whole notion of looking as young as you feel. Well, you actually have to feel young, and there's things that are in your life that you can do to feel young and vibrant, etc., that you have to do. Joni represents that. She takes great care of her body. She eats really well. She has been an incredible steward of her skin. She's done all the right things for her skin from a sun protection point of view. She's been on trifecta for a number of years, and before that she was doing all the important actives that I talk about all the time as well. So when she came to us, I was able to basically take that beautiful looking skin, which I say two-pronged approach, skin and shape, and create a youthful shape that basically brought her back to a very significantly younger version of herself, erasing a lot of the aging changes and giving her face an identity that matches her spirit and matches her vibrant self. It would have been nowhere near as satisfying and as natural and beautiful looking of a result if she hadn't been taking care of her skin. And you've all seen it. At 76, all that sun damage, coarse lines and wrinkles, all that kind of stuff can really, really impact the outcome. You look like a tight version of somebody who's older, but not necessarily younger looking. But when you have the youthful skin, that's where you start to see that. That right there is the absolute essence of what this is all about. It's about closing that gap between the way we look and the way we feel. The appearance oftentimes needs to gel. And when the jowls start to come and the neck starts to come and the eyes, you look tired, you look gaunt, you look, frail, all of that starts to wear on a person's psyche. And that is the number one reason the majority of people do the surgeries that I perform for them, is because they want to look as young as they feel. It's never too late. You're never too old to do such a thing. If you're healthy, you don't have any medical problems, you have that youthful spirit, and you want to have an operation like this, by all means, go ahead. That's the lesson, and that's the noteworthiness of Joni's case. All right, folks, I hope you guys enjoyed that video. If you have any questions, drop them in the comments below. If you just simply like the video, hit like. If you haven't already, make sure you subscribe to the channel. Visit my website, drkaram.com, if you want to see more results, and definitely check out the trifecta at KaramMD Skin. It is a very simple and super effective way of managing your skin, something that all of you, regardless of whether you have surgery or not, should definitely be doing starting now. All right, folks, until next time, Dr. Amir Karam.